Welcome back. You know, currently here in the U.S., there are more than 3.8 million breast cancer survivors, including those being treated and those who have finished their treatment. The vast majority are women, although breast cancer can affect men. And since October is Breast Cancer Awareness Month, we want to talk about the story and give some hope for those in their fight. Pamela Hunter, the executive director of the Baller Dream Foundation, is joining us now as we are talking about the importance of maintaining, a positive outlook when you get that diagnosis.
Yes, that's a difficult part about it, I think. And I think what I ended up doing was just trying to learn as much as I could about what the possibilities for treatment were, and talking to other people who've had breast cancer in their past. And like I said, that was the learning more about it. And I would like to say that the early detection was what saved me. Good. And I never miss a mammogram. My doctor orders one every year. And in this particular year, in 2019, in December, I had my annual one. And I got called back for a second one in 2020. And also told that I needed to have an ultrasound done. I knew then that there was some suspicion that there was something, but I've had that happen in my past before because I have very dense breast tissue. Okay. And so sometimes the mammograms don't show as much as you might think. But fortunately, they've got the 3D mammograms now that go through, and basically it's like taking up slices of your layers of your breast, so they can uncover things that they couldn't see before.
With that imagery.
And they have that recently now over at the hospital where I get my mammogram, which is over at Thomas and Fairhope.
So had you had any family history of breast cancer?
Not really. I have one first cousin, and that is it. No one like aunts or my mother or anybody on the other side of the family.
So how long have you been living with breast cancer? Because we know that you can beat it, but it always is with you.
Yes, it does stick in the back of your mind, but I will say I was given such a wonderful prognosis that when I went to go afterwards for treatment to have a maintenance treatment with an oncologist, he told me I did not need to continue to be his patient, just to continue what I was doing with my gynecologist and regular doctors. Yeah. That's because I chose a very different procedure than most women probably don't go through. I wanted to take a very radical approach to it. I didn't want to have to worry every year that it could come back.
And what did you do?
I did a bilateral mastectomy.
Okay.
And reconstruction. And the type of reconstruction I did was a nipple-sparing reconstruction, which is, I was told by a couple of doctors they couldn't do that procedure, but I found someone that is very, very skilled in that area, and it worked out wonderful.
It worked out wonderful, and I want to end it there on a positive note. What is your message to others during this month of awareness? Talk please directly to the camera.
All right, make sure you have, go see your doctor, whether it's your primary physician or your gynecologist annually. Pap smears are important, and they should then also order, depending on your age, that you go into the hospital or a breast center and get your annual mammogram. And there's certain guidelines for certain ages. Mine, I've had a history of these fibroids and cysts, so I've been going annually for forever, it seems like.
So the message is get those screenings.
Yes, they can detect so much now that they didn't.
Appreciate you stopping by. We're out of time. Of course, you can watch this interview again. We'll have it there posted for you. And yes, if you are going through breast cancer, know that we here at Fox 10 are with you. And again, thank you, Pam, for stopping by.
Thank you, Lenise.